Welcome to this morning's briefing, Maternal and Child Health, Tackling Disparities, Improving Outcomes. I'd like to start by thanking our sponsor, AMAG Pharmaceuticals. According to the Centers for Disease Control and Prevention, 1 of every 10 babies in the United States is born prematurely, and 6 of every 1,000 die before reaching their first birthday. While the infant mortality rate has been declining over the years, African American infants are twice as likely to die as white babies. When it comes to maternal health, deaths related to pregnancy have actually increased in the United States over the past quarter century. The data is even more stark for women of color. African American women are up to 4 times more likely to die of pregnancy-related complications than white women. Despite advances in medical care, why is the United States lagging behind other developed countries when it comes to maternal and child health? We're looking for answers to these questions and more, and have a terrific group of speakers joining us on stage for these series of conversations. Before we begin, a few housekeeping notes. In addition to our audience here at the museum, we're live streaming on thehill.com/events. Please do keep your phones on silent, but we encourage you to join the discussion on social media. You can follow us on Twitter at The Hill Events and using the hashtag Maternal Health Equity. We're going to be taking questions from the audience, so please be on the lookout for members of our team with handheld mics. Finally, there's a short feedback survey on each of your chairs. Please make sure to fill those out. We'd love to hear more about our events, so I encourage you to complete the survey at the end of today's program. So let's dive right in. We begin this morning with Congressman Roger Marshall. A freshman member of Congress from Kansas, Dr. Marshall is also a physician. As an OBGYN, he's delivered more than 5,000 babies. In the U.S. House of Representatives, he's a co-sponsor of a bill that seeks to prevent maternal deaths and improve health outcomes for pregnant women. Please join me in giving a warm welcome to Congressman Roger Marshall. Joining him on stage is my colleague, the Hill's editor-in-chief, Bob Cusack. Bob, over to you.
Thanks, Diana. Congressman, thanks for joining us this morning. So, you're an OB-GYN.
That's right.
You've delivered more than 5,000 babies?
That's what my staff tells me.
You must have a lot of stories. So tell us about your personal, you're a politician, you're a doctor. On this issue in particular, what do Washington policymakers need to understand of why the U.S. is lagging behind other countries?
Yeah, I think it's as much how do you get your issue to the front of the plate here. We have so many things going on right now. I describe Washington as a place where there's a very finite amount of oxygen. You know, 165 people are dying every day from opioids. We're dealing with an immigration issue right now. So how do we get this issue to the forefront? So when I go talk to other members about this as a physician who happens to be in Congress, how do I let them know that this is put this on the front burner? There's an opportunity to fix this. Mm-hmm.
But as far as what non-doctors in Washington, what do they not get about the practice of medicine that you and other doctors in the House and Senate try to tell them?
Yeah, exactly. I think the message I would tell other members when I see them is that the mortality rate for moms has doubled in the past 10 years. We're not sure why, but there's an opportunity to fix this problem. So as a physician, I like to fix problems. Every 9 months, I got to fix a woman's problem, so to speak, and give her a blessing as well. So I think that's what we have to do is communicate to other members. This is double. This is a big deal that 2 women die every day related to childbirth or during the pregnancy or after the pregnancy.
And those are remarkable statistics, and this issue doesn't get the headlines of other healthcare issues. So what are the solutions? There's pending legislation. What's the role of the administration and HHS? Getting at solving this problem that you point out has gotten worse.
Right. So I think there's several solutions out there. And certainly from a congressional standpoint, we have a wonderful bill out there. Congresswoman Jamie Herrera Butler has a wonderful bill out there. And I think part of the solution is I need folks that are in this audience that are listening to this is to contact their Congress member and their senators and say, please co-sponsor this bill. We think it'll be on the Senate floor next week. We need to get it out of committee. Email Paul Ryan and Kevin McCarthy, who are the decision makers for what reaches the board. But I would also say this, look in the mirror. What can you do in your own own states. Why do we need to wait for Washington to act on this? I think that as we take the layers of onions off of maternal mortality, it's going to be a little different for different states. So I think, California's doing a great job with it, actively addressing this. What our legislation would do is to help give grant money so that every state would study every maternal death, figure out the true causes, and then try to put the pieces together, what we can do to help solve those problems.
I just want to go back to, because a lot of people think that Congress is basically done for the year and the election is upcoming and nothing can get done by that. But honestly, in the last month or so, there's been a fair amount of legislation that's gotten through, revision of Dodd-Frank, among other things. So this bill that you mentioned, Congresswoman Herrera Butler, who will be speaking later, has 137 co-sponsors. You're a co-sponsor. Gwen Moore, who will also be speaking, she's a co-sponsor. So it's a bipartisan bill. Have you talked to leadership? I believe this bill was referred to the Energy and Commerce Committee or the Chairman Walden about moving this bill, especially if it's moving in the Senate. Usually bills move first in the House and then they kind of get stuck in the Senate.
So that's the great opportunity we have here. So when you call your Congress members is to say, please co-sponsor this bill. It's moving in the Senate. The Senate is setting on over 500 bills that the House has done that they're not acting upon. So if I hear that there's a path to victory here, a path for a bill to be signed by the Senate, by the President, it's going to go way up on my list. So I think that if we can convince Kevin McCarthy that this is a great opportunity for America and to put it to the front of the list, we can do it.
And is this bill pricey? What would be a reason to oppose it?
I can't think of any reason to oppose it. I don't think I've seen it's been scored yet. Maybe you all have seen the number, but I would think it would be in the tune of several $1 million. And really, most of the states have the infrastructure to do it. And all we're going to do is just ask that the local state public health department take the onus upon themselves to figure this out. There's no reason why each governor couldn't appoint a small committee. We're all asked to do different committees all the time. I would love to be on this particular committee where I review all the maternal deaths in the state of Kansas. We have to get through some HIPAA issues, and I hope we can figure out how to do that.
Like privacy stuff.
The privacy issues. I don't need to know the patient's name. I don't need to know the doctor's name. But there has to be a way that this country reviews every maternal mortality, to figure out why. There's only about 700 per year. This is very doable.
Well, we're going to open up for questions in a few minutes, but you are there and with 5,000, delivering over 5,000 babies and protecting the mom, protecting the newborn. What do you think are the issues? Because you're involved in it, you see other providers doing the same thing. Is it a lack of training? Is it hospitals and doctors not being on the same page?
Yeah. So I would look at it, first of all, what we know is causing the deaths, and then are they preventable or not? So we kind of look at the big picture here. The leading causes of maternal mortality are typically that the mom has a pre-existing medical condition, diabetes, a heart problem, a history of hypertension. That's about 30% of these deaths. And then after that, you go to sepsis, preeclampsia, hemorrhage, what am I missing? Cardiomyopathies as well. So we have a group of women that are at high risk. I think that we're just not acting like a team very well. These are the exact same issues when I was in medical school, when I started residency. When I started residency, only about a third of the women were not getting prenatal care, and there wasn't access to family planning either. So the residents got together, we started a Saturday morning clinic to make sure that every woman had access to prenatal care. When I moved back to rural Kansas, Great Bend, America, I made sure every woman had access to prenatal care and access to family planning. So what we think of, the things that we could prevent to help impact this situation is, number one, is to decrease the number of unwanted pregnancies. So we need to make sure that women have access to family planning and that the money is not a barrier to that. Number two is we need to make sure that women have access and get the prenatal care. We know the women that don't get prenatal care, much higher risk of dying or having serious morbidity as well. Those are two very simple things. And the third thing we need to do is if a woman has a medical problem, before she gets pregnant, we need to make sure that she's in the best health that she can be, that we have her blood pressure under control, her sugars are under control, that we've done everything, that she's already on prenatal vitamins. And I'm going to add this. I think nutrition is a much bigger issue than we're giving it credit for. And I think that we need to make sure that 6 months, a year before women try to conceive is that they're having good nutrition as well. I think that could favorably impact this. So those are just the basic ideas. Family planning, prenatal care, take care of whatever medical problems you have, and then we'll get to some of the issues. As I read some of these stories, it just scares me to death. We went through 20,000 pregnancies in residency, 10,000 pregnancies in Great Bend with 0 maternal mortalities. And not because I'm such a great obstetrician, but we had a great team. My nurses prevented more deaths than any deaths that I could, because they knew, say, when the woman called in and said, gosh, I'm due in a week, my swelling, I'm having headaches, I'm having blurred vision, I'm having pain underneath my chest. They knew they had HELLP syndrome over the phone. They'd seen enough HELLP syndrome that they knew what that was. My nurses in my office, the nurses on labor and delivery, that prevented lots of deaths. Our WIC nurses, our health department nurses, the Catholic Social Services, we were all working together to say what patients, when those nurses said, Dr. Marshall, we need you now. My family doctors did a great job. The pediatricians I worked with were incredible. Anesthesia was A+ as well. So it was this team effort. So we had 0 deaths in 30,000 deliveries. And what we're talking about here is it's about 1 out of 5,000 women today have died during something related to pregnancy. So we can do better. Our goal, we need to make a goal. We should cut this maternal mortality rate in half within 2 years. We can do that.
Do you think, I mean, a lot of that is communication and education. Do you suspect that in other facilities, that kind of communication where the women, they don't know to take the prenatal vitamins, they don't know to do all the things you just mentioned. Could that be improved, do you think?
So my biggest challenge in my professional life has been communication. But so often, it's my health departments, it's the Catholic Social Services. Those are touching those people before I ever see them, the women that are going to become pregnant, especially the women that weren't trying to get pregnant, some of those people. So absolutely this communication where I was supervising the health department. I would go there at least once a month for a family planning clinic as well. And those nurses were able to approach me and say, hey, we have this particular challenge. What do you think we could do about it? Can we start giving Depo-Provera? How do you feel about Depo-Provera as far as family planning? Of course, it's very commonplace today, but 15 years ago it wasn't. So always trying to make sure that our health departments had access to state-of-the-art family planning. Communication, absolutely, but it takes some experience too. I had the same 3 nurses for 25 years that worked for me. The first 3 nurses I hired are still working for me, and those nurses knew when a mom was having problems. And if it's her mom with her 3rd baby and she calls in and says, I'm bleeding, she's not calling you because of something insignificant. So my nurses knew who to say, get on in here and let us check you.
You mentioned rural health. Is there a big disparity between rural and urban health as far as quality of care?
That's a big myth, actually. I think that if you really look down into the statistics, that the rate of maternal mortality is the same in rural America as it is in quote, big cities. But the same woman, if she doesn't have prenatal care in either one of those locations, falls into the high-risk group. So it's not about being in rural America or a big city. It's about a lack of family planning. It's about a lack of prenatal care access. It's about a lack of having your medical problems under control. Does that make sense, what I'm trying to say? I think it's a huge myth. I think there's a cutoff. If you're only delivering 50 babies a year in a facility, that kind of concerns me. I think that repetition is much better. We would see 4 or 5 women every year with HELLP syndrome. So it didn't scare my nurses. They knew how to recognize it. We saw preeclampsia every week. We had a clinic full of diabetics. So there was some repetition. There were protocols how we took care of those women. We knew what a high-risk pregnancy was. So I think we have to be careful to not deliver in too small of facilities, but as long as women have access to prenatal care, access to family planning, their medical conditions are under control, it shouldn't matter if you're in Great Bend, Kansas, or in Kansas City, Kansas.
We're going to open it up for questions. We are live streaming on thehill.com, so we have people with microphones. If you can identify yourself and just wait for the mic and ask a quick question so we can maybe get 1 or 2 in.
Hi, I'm Marianne Mass. I'm a pediatrician in the Philadelphia area and a practicing physician, and I'm an advocate for my profession and my patients. And one of the things that I've seen over the last 20 years is an absolute increase in the amount of time that physicians have to spend on the computer, on paperwork, on the phone, with insurance companies, fighting their hospitals, fighting their administrations. Excuse me for saying it in such a way, but blah, blah, blah. So I sort of see it as one of the issues with access, and I'd like to know what is Congress and the administration doing to reduce the burden that physicians and nurses have so that patients can actually get this access? Because I see it as one of the two big problems in the healthcare sector today. Thank you.
Go ahead, Bob.
That's all you.
Yeah. No, I think, first of all, to your point, at some point when I was doing medical records, implementing electronic medical records, I found myself, my gosh, I'm staring at this screen. And what I have with my OB patients is a relationship. So I see them on their first prenatal visit. They'll probably have 10 or 12 visits. When a pregnant woman walks into my room and she has facial edema and her blood pressure is a little elevated and she has a trace of protein, my antenna's going off. So if I've seen this woman on a regular basis, I need to look at my patient. And I think that most doctors would say they're spending a third of their time working on their electronic medical records. What Congress is doing is not enough. We'd like to figure out how we can make some of the macro and some of those issues simpler. I'm trying to work with Seema Verma, and she's certainly amenable to figuring out how to do it simpler. I think there's a lot of data they have without making our physicians enter that data. I had to increase my nursing staff from 3 to 5 nurses with the implementation of medical records. And we were seeing this with the electronic medical records, seeing the same number of patients. So it's a huge burden on my nursing staff. Basically, I made them data entry people. And they're more concerned about checking off a family history than they were trying to make sure, well, what's this patient's blood pressure? If it's a little elevated, repeat the blood pressure. Make sure that urine protein is done before I see her. Make sure I have her sugar when I walk into the room. So it has taken our eye off the ball. It's medical records, electronic medical records has been a disaster.
Thank you very much, Congressman, for addressing the issue. My name's Jamie Zalloway Balsido. I am of Effie's Grace, and I'm also a commissioner with the Commonwealth of Massachusetts for the Postpartum Commission under Charlie Baker. I am hearing that this has been an issue for 2 decades that you're citing. So really, where is the political will at this point? Why are we having to address this issue at the 11th hour in this Congress? Why are we being commanded to beg for the leadership to hear an issue that is as American pie as can be? We're talking about moms, we're talking about babies. In the Commonwealth of Massachusetts, we are very blessed with having someone like Karen Downs at the DPH who runs the Maria program to track all of our maternal mortality data. This is not rocket science. This is just kind of commonalities and going back to the records part, of which I appreciate you speaking to. So really, and again, your expertise on this issue is paramount to what we're talking about, because you saw the good, the bad, and the ugly. But honestly, where it is your party that we are looking to support and to bring this issue to the forefront, aside from calling McCarthy and the other leaders, where does the political will on this issue tip the scales if we're talking about a 2-decade growing issue? Thank you.
Yeah. I would just respectfully turn it back upon the physicians, the nurses, the health departments, the state health departments. The federal government can't solve all your problems. The federal government does move very slow. I think that people solve the problem. I think that physicians can solve the problem. I think that nurses can solve the problems. To help accentuate it, provide some monies to get it going. But like I said before, I think there's so many issues that need to be addressed right now. So many issues have been addressed, have been kicked down the can for decades. And now we have a president that wants to stand up and address these issues. And I think we have leadership. I think Kevin McCarthy, Paul Ryan want to address these issues. But there's literally so many hours in the day, and then it's time to prioritize. So we've spent the last 2 months trying to figure out how to fix this opioid crisis as well. So I think I'm very certain if we can get this to the floor, that it'll be voted yes upon.
Do you think that there's a lot of ways bills become law. It can be standalone. Do you think that this could be something that could be put in omnibus in September?
I think the best path forward would be to hook it on to some type of a must-pass bill.
Okay.
And whether it's a funding bill, or the farm bill, for goodness sakes, something like that. So hopefully we'll be voting on a farm bill at the end of this month as well. So what this group, convening this group, gives me the chance to go speak to Kevin McCarthy today and say, Kevin, this is a very simple idea. It's all teed up. Where can you find a place for this? Kevin does a great job with that. He'll find a place for it if we can convince him it's a priority.
Do you think you'll pass a farm bill? And what about immigration? That's also an issue.
Oh my
That's a big
gosh.
issue.
Yeah, so I absolutely think we'll pass a farm bill. I'm somewhat optimistic on an immigration bill. I can't tell you what it's going to look like, but it's a huge issue back home. And certainly I'm glad that we're taking on a very tough political issue. So hopefully next week we'll vote on some type of an immigration bill.
Because they're tied together now. I mean, obviously, the first farm bill didn't succeed because of immigration, but you think that one could pass? I mean, even without an immigration deal, that the farm bill could pass?
I think what leadership did is promised ultra-conservatives an opportunity to vote on an immigration bill. And once we do that, I think that we'll be able to move a farm bill and pass it.
Last question. What can stakeholders, and I mean associations in Washington who are watching this, I mean, other than lobbying for the Herrera-Butler bill, but how can they help this, whether it's in the states or in Washington, working together? Because as you know, a lot of healthcare groups, sometimes it's provider versus provider in any type of lobbying battle. What can they do? What's their role?
Yeah, I think that every association, this should be an easy, we have to help each other out whenever we can. So I try very extensively to get the AMA to work with ACOG, to work with the orthopedic surgeons, all the different groups. So we have to work together on issues that are important. And I think that this should be a slam dunk for any medical association, the nurses associations, all those folks, to be able to reach out together, to provide their members phone numbers, emails for Kevin McCarthy, for Paul Ryan, for your own members. You could go to our website or to our Facebook and get contact information as well. If you just Google Roger Marshall, MD, you'll find our websites. But I think just that rallying point to say, this is the time. Your voices do matter. And if we have one loud voice, it's a lot better than different fractions fighting with each other, as you said.
Well, we've run out of time. Please thank the Congressman for joining us this morning. Thanks so much.
You bet.
Hey.